Erin, we need to wait for your spinal anesthetic to wear off completely before you can work with physical therapy. Since you're nice and awake, would it be okay if I started reviewing discharge instructions?
Yeah, absolutely.
Perfect. This is your after visit summary, and it has all your instructions that you should need from now until you see your surgeon in the post-op visit. You do not need to remember all of this and/or try and memorize it. We send it home so that both you and/or a family member can review it later.
Okay.
If your family member was here, I'd have them come in. Since they aren't, you and I will go over it, and I ask that they review it later.
Sounds good.
Let's start at the top with the reasons that you should call your surgeon. His phone number is right here, and we've highlighted it. There are a variety of reasons to call him. The first one being surgical site redness, excessive swelling, warmth, or drainage that is yellow or green in color and has an odor. For fevers 101 or higher, chills, flu-like symptoms, persistent vomiting or diarrhea, or excessive pain that is not relieved by pain medication that has been prescribed. Additionally, your surgeon would like you to notify them if you are running low on pain medications and would likely need a refill. Please make a call regarding the refill during the week before you have completely run out. Please seek immediate medical attention for calf redness, pain, and/or swelling, and call 911 for shortness of breath and/or chest pain.